Proteomics Laboratories Limited, ASX PIQ, is a precision diagnostic company in the medical technology area. And joining me right now is Managing Director, Dr. Richard Lipscombe. Hello, Richard.
Hello, Tim. Good to be with you.
It's great to have you on again and very exciting news. Let's start with the four products that you're going to market with being ProMarker D, Endo, ESO, and OxiDx.
Yes, four tests, each potential game changers for different audiences. They're tests that we've developed using precision diagnostics platforms. And the first one, ProMarkerD, is for predicting diabetic kidney disease. That affects everybody with diabetes, and that is about to go live in a number of markets. ProMarkerENDO for endometriosis, a very nasty, painful condition that affects 1 in 9 women and girls around the world. We just announced and published some really exciting results, groundbreaking results in an ability to diagnose different stages of this disease. And particularly important there, we're able to diagnose the early stages of the disease. That's the breakthrough that we've just published in one of the major medical journals from Europe. The third test, ProMarkerESO for esophageal cancer, that's a cancer that has a very high mortality rate if you're diagnosed, less than 20% survival rate after 5 years. And that test is very close to coming to market as well. And we've got really good results that we published towards the end of last year on diagnostic accuracy for that. And then last but not least is our new test, OxiDx, for oxidative stress, which affects a whole range of diseases. But in the context of a recent study that we've been doing and published, we can pick up really early muscle damage, and that's important in a whole range of athletic performance, from athletes in marathon runners, where we did the study, through to the horse racing industry. So each of those tests is at the stage of coming live in 2025 in different markets around the world.
It's been quite a few years since I first came across the company and its activities. And so now we're approaching that point, well, you're approaching that point with these products of being able to sell them globally. Now, I understand in Europe you have certification, but the goal is, of course, to spread across other major countries like the US and Asia.
Yes. So ProMarkerD, we do have CE mark in Europe, and we can sell that there today. The target market, the main big market, is obviously the US. We are in the process of establishing Proteomics International Laboratories US and a specific laboratory to run the ProMarkerD test there. The test and the laboratory is going through an accreditation process known as CLIA. And once that certification is in place, we can start selling the test in the US. So that's ongoing with a view to having the test go live in the US in this first half of the calendar year. The other obviously important market is a home market, and with slight shifts in the regulatory framework, we're able to bring ProMarkerD through to an Australian audience under a specialist accreditation known as ISO 15189. And our laboratory is in the process of getting that certification now. And once that's complete, we can offer ProMarkerD to an Australian audience. And we're targeting this quarter to launch ProMarkerD in Australia. So very exciting time for that test.
So you'll have strong cash flow very soon from this product service.
We'll certainly have cash flow. With all new tests, there's always the challenge of how quickly you can get adoption, and it's very hard to predict that. But we know that the ProMarkerD test has no direct competition in Australia, no competition in Europe, limited competition in the US. And in the US, we have pricing at $390 US, so it's a very affordable test by US standards, and we'll look to mirror that pricing across the world. So it's a test which has very high impact for patients because of the amount of money that we can save for healthcare systems and the change of life for patients. Whilst the test might sound expensive, the alternative of dialysis is a $70,000, $90,000 experience, and clearly completely detrimental for the patient, and healthcare systems can't cope. So in terms of cash flow, we'll look forward to generating cash flow and seeing how quickly we can build on that.
So a quick question about ProMarkerESO, the esophageal cancer or throat cancer. Now, 1 in 20 cancer patients die from esophageal cancer. And I noticed that the cost to do those tests in the UK and the US are very high, in the thousands of dollars. What would be the comparative costing for the ProMarkerESO test?
The ProMarkerESO test will be very competitively priced against the existing standard of care. So that procedure that you've described for the esophageal cancer at the moment is an endoscopy. A pipe is stuck down the throat and a biopsy is taken, and then that's looked at under a microscope. So that's quite an invasive, uncomfortable procedure, half a day or a day off work, and costly. And as you allude to, cost $1,000, $2,000, $3,000 or pounds or euros. So we envisage that ProMarkerESO would be able to significantly undercut that in terms of price, because it's a more straightforward process, and we envisage similar pricing perhaps to the ProMarkerD test. That's still something that we're finalizing.
So, pending the launch of these products on a commercial basis, the company has been touring the world, and this year you're looking at USA, India, and more conferences in Australia to get the information to prospective end users of the product. You have not a marketing, but a sales strategy of the traditional sales of products, but also a hybrid pipeline. Could you explain the difference between those two?
Yes, I can. And I'll put it in the context of where we're heading with our commercial strategy and why this is such a pivotal time, but an exciting time for the company. So we've obviously been known as a research and development company for a number of years, and we have best-in-class scientists, best-in-class team, and one of the few groups in the world that can actually develop these types of precision diagnostic tests. So we're world leaders in that. When it comes to selling a test, that's a skill set that exists globally, and we can buy that skill set, we can acquire that skill set, and that's what we've been doing over recent times. So either putting people on in-house or partnering with groups who do these range of different selling marketing avenues. And so to be specific, what we're looking at is a direct-to-consumer or direct-to-patient model for our tests. So the consumer, for the majority of our tests, could be the general practitioner, primary care physician in the US, as well as the patient themselves. If a patient is interested, if a GP is aware of our tests, they will be able to click on a button and order the test. So a patient would go to a website, express an interest, and then go and see their GP or have a telehealth consult. If they're eligible, if they fit the profile that needs the test, then we can tell them where to go and get a blood sample collected, and that blood sample will then be sent to our laboratories, and we can run that test, provide the report back to the treating physician, and go from there.
So it's not quite over the counter. But anyway, continue.
No, it's not over the counter, no, but it's in the modern world, you can do almost everything online, and you can certainly get your health checked up online, and you can find out a lot more about the test. So in the context of this, certainly within a 7-day turnaround from a patient being or an individual being interested, they could find out about the test, talk to a medical practitioner, have a blood sample taken, and get a result. So it can be very quick compared to the current standard of care for these tests, which obviously takes, well, if it's a surgery for endoscopy, for endometriosis, for esophageal cancer, these are very difficult procedures to do. So our alternative is there. And that then sits alongside what we would call a traditional licensing model, where we partner with the big diagnostics company, the pathology companies who want to provide new content and specialist tests like ours, which are very appealing. And we continue to engage with those groups in different parts of the world with a view to bringing the test forward under what we might call a traditional model, where we would license the test to that organization and they will run the test on our behalf. But if we come back to the direct-to-consumer, direct-to-patient, the benefit of this model is we control that process and we get a much greater share of the revenue, because we will be providing the test. It's our scientists, it's our clinical team that will be running the test. And that's something that we've been able to develop a great deal of skills in. So our laboratories run very efficiently, and there will be a healthy margin in providing the tests ourselves.
It does seem to me that, if a patient is faced with invasive surgery versus a blood test, I know which box I would tick first.
Yes, and that's certainly the feedback we've got from talking with our marketing companies and the patient advocacy groups that we've been dealing with. There is a lot of interest in all the tests, obviously endometriosis in particular, which is a completely underserved condition and really is crying out for a new diagnostic test. But even for esophageal cancer and diabetic kidney disease, there's so much more that can be done, and we have the ability to help those individuals and those patients.
So a wonderful pipeline of products, 4 products from precision diagnostic company Proteomics Laboratories Limited, and I've been speaking with Dr. Richard Lipscombe, listed on the ASX as PIQ. Go to their website, look them up now. Have a look at the most recent quarterly where you'll see in-depth commentary on these products and services. Thank you, Richard, very much for joining us today.
Thank you, Tim. Always a pleasure.